Understanding fluid and electrolyte balance is crucial for nursing practice and is a key topic for the NCLEX exam. Here's a comprehensive overview covering the basics, important concepts, common imbalances, assessment, nursing interventions, and practice questions. Fluid and electrolyte basics. Body fluid compartments. Intracellular fluid, or ICF, is the fluid within cells, making up about 2/3 of total body water. Extracellular fluid, or ECF, is the fluid outside cells, accounting for about 1/3 of total body water. This includes interstitial fluid, which is found between cells, intravascular fluid, which is within blood vessels or plasma, and transcellular fluid, which includes cerebrospinal fluid, synovial fluid, and so on. Main electrolytes. Sodium, or Na+, is the major extracellular cation with a normal range of 135 to 145 micl. Potassium, or K+, is the major intracellular cation, with a normal range of 3.5 to 5.0 micl. Calcium, or K2+, is important for bone health and muscle function, with a normal range of 8.5 to 10.5 mg/dl, and ionized calcium ranging from 4.5 to 5.5 mg/dl. Magnesium, or Mg2+, is crucial for enzyme function, with a normal range of 1.5 to 2.5 meql. Chloride, or Cl, is the major extracellular anion with a normal range of 98 to 106 micl. Bicarbonate, or HCO3, is important for acid-base balance with a normal range of 22 to 26 micl. Lastly, phosphate, or PO4 is primarily an intracellular anion with a normal range of 2.5 to 4.5 mg/dl. Fluid balance concepts. Homeostasis is the body's ability to maintain stable internal conditions. Osmosis is the movement of water from an area of low solute concentration to an area of high solute concentration. Diffusion is the movement of solutes from an area of high concentration to an area of low concentration. Filtration is the movement of fluid and solutes across a semi-permeable membrane due to hydrostatic pressure. Common fluid and electrolyte imbalances. Fluid volume deficit, also known as dehydration, can be caused by excessive fluid loss, such as from vomiting, diarrhea, or diuretics, and inadequate intake. Signs and symptoms include thirst, dry mucous membranes, low blood pressure, increased heart rate, decreased urine output, and concentrated urine. Fluid volume excess or overhydration can be caused by excessive fluid intake, renal failure, or heart failure. Signs and symptoms include edema, hypertension, weight gain, jugular venous distension, shortness of breath, and crackles in the lungs. Electrolyte imbalances are also common. Hyponatremia, which is low sodium, can be caused by excessive fluid intake, heart failure, or renal failure. Symptoms include confusion, seizures, muscle cramps, and headache. Hypernatremia, or high sodium, can be caused by dehydration or excessive salt intake, with symptoms like thirst, dry mucous membranes, restlessness, and confusion. Hypokalemia, or low potassium, can be caused by diuretics, diarrhea, or vomiting. Symptoms include muscle weakness, fatigue, and arrhythmias. Hyperkalemia, or high potassium, can be caused by renal failure or excessive potassium intake, with symptoms like muscle weakness, arrhythmias, and peak T waves on an ECG. Hypocalcemia, or low calcium, can be caused by hypoparathyroidism or vitamin D deficiency. Symptoms include muscle spasms, tetany, and seizures. Hypercalcemia, or high calcium, can be caused by hyperparathyroidism or malignancy, with symptoms like nausea, vomiting, confusion, and kidney stones. Hypomagnesemia, or low magnesium, can be caused by malnutrition, diarrhea, or alcohol use. Symptoms include muscle cramps, twitching, and arrhythmias. Hypermagnesemia, or high magnesium, can be caused by renal failure or excessive intake, with symptoms like muscle weakness, hypotension, and respiratory depression. Assessment. Monitoring vital signs is crucial, so keep an eye out for changes in blood pressure, heart rate, and respiratory rate. Conduct a physical assessment to look for signs of dehydration, like skin turgor and mucous membranes or fluid overload, such as edema and lung sounds. Laboratory tests are also important. Check serum electrolytes, including sodium, potassium, and calcium. BUN and creatinine levels should be assessed to evaluate kidney function. A urinalysis looking at specific gravity and osmolality can provide additional information. Nursing interventions. For fluid management, administer IV fluids as ordered, whether isotonic, hypotonic, or hypertonic solutions. Monitor intake and output and encourage oral fluid intake if appropriate. For electrolyte management, administer electrolytes as ordered, like potassium chloride for hypokalemia. Monitor labs and observe for signs of imbalances. Patient education is another key intervention. Teach patients about dietary sources of electrolytes, educate them on the signs and symptoms of imbalances, and discuss the importance of medication adherence, such as taking diuretics as prescribed. Practice questions for NCLEX. A patient is experiencing muscle weakness and fatigue. Lab results show a potassium level of 2.8 mg/L. What is the priority nursing intervention? A. Administer potassium supplements as ordered. B. Encourage increased fluid intake. C. Monitor vital signs frequently. D. Perform a neurological assessment. The correct answer is A. Administer potassium supplements as ordered. Next question. A patient with heart failure presents with edema and crackles in the lungs. What is the best nursing action? A. Encourage fluid intake. B. Administer a diuretic as prescribed. C. Perform a thorough neurological assessment. D. Increase sodium intake. The correct answer is B. Administer a diuretic as prescribed. Conclusion. Fluid and electrolyte balance is essential for maintaining homeostasis and ensuring optimal body function. Understanding the concepts, common imbalances, assessment techniques, nursing interventions, and patient education is vital for nursing practice and NCLEX success. Familiarize yourself with these topics to provide safe and effective care to your patients.